very much, Dr. Gina. She is talking about the aging brain. God bless you. Thank you.
Oh, you're welcome, Moselle. Thank you for that wonderful introduction. Don't think I deserve all that, but thank you. Uh, this is going to be a presentation. We had the lovely Miss Lisa Smith last week who gave a super duper presentation. This is more of a little bit of a more of an academic type presentation, something facts about the brain, everything you want to know about the brain, but we're afraid to ask type deal. So welcome Eating Healthy Family to this presentation that we're going to go through. Next slide, please. And this is just going to be a brief review of the brain. And next slide after that one. So this is the brain. Okay, this is how the brain looks. It's a 3-pound ball of fat, basically. It's about 60% fat. Most of that fat are fatty acids that we don't really get naturally. So we have to put those in our body by eating certain things. But we have different lobes of the brain. The frontal lobe is the largest lobe of the brain, and that's where we do most of our planning, our executive functions. It helps us with impulse control and helps us with short-term memory. Then we have the parietal lobe, which is sort of at the top around here. And that's where we feel our sensations, such as touch, pain, also positioning and posture and our balance. Then we have the temporal lobes, which sit behind our ears. And that's called the auditory lobe. And auditory means hearing. So that lobe of the brain controls hearing and processes our auditory functions. The pons is a little small area kind of below the temporal lobes. And that's where we generate our respiratory rhythms, and that helps with our breathing. So that part of the brain helps with our breathing. The medulla oblongata is the long piece that sits below the brain or the pons. And that's sort of like a transition area between the brain and the spinal cord. So there are lots of signals and things that transverse that area between our spinal cord and our brain. And then we have the cerebellum, which is called the little brain because it kind of looks like a brain, but it kind of sits by itself. And that's where our coordination is, our voluntary mechanisms such as our balance, posture, coordination. So that's, again, called the small brain or the little brain. And then down from there is our spinal cord. And that is a very important part of our anatomy, where all of our nerve endings, our nerve synapses transverse that area and controls our digestion, our urination, heart rate, and body temperature, and just on and on. So as you could see, if any of these areas are damaged, then depending on where that damage occurs, it may, our hearing may be affected, our body movements, our respiratory, our speech, and a number of things may be affected. So it's important to know a little bit about the anatomy of the brain. So next slide. So the brain contains billions of nerve cells with trillions of connections called synapses. So there are billions and billions of nerve cells in our brain. And the 60%, of course, of the brain is made of fat. Interestingly enough, the brain is not fully formed until about age 25. So you really can't get mad at your young adult kids if they're not doing what you want them to do, because their brains are not fully formed. And some studies say that the brain is not fully formed until about 30. So we understand, why some young adults act as they are, because their brains aren't fully formed. Brain impulses can travel up to 268 miles per hour. So those brain functions are going super fast between the synapses in our brain. So that's why we can do things quickly, because those impulses are traveling at a high rate of speed. Next slide, please. Now, the spinal cord stops growing by age 4. So by the time we're age 4, our spinal cord is completely done growing. Even though we may continue to grow, our spinal cord stays the same by age 4. Now, we have heard a myth that we only use 10% of our brain, but that's not true. Neurologists confirm that we use all of our brain in all of the time. So even while we're asleep, we're still using our brain. And studies show now that sleep is important, not only because we just need to rest and we need to regroup, but also during sleep, our brain gets rid of waste. So the things that accumulate in the brain, the waste products that accumulate in the brain are being released as we sleep. So that's an even more important reason to get our 7 to 9 hours of sleep. And I'm sure we all get 7 to 9 hours of sleep per night, right? How many people raise your hand? And it says a piece of the brain the size of a grain of sand contains 100,000 neurons and billions and trillions of synapses, as we stated before. So next slide. And here's a picture of the brain cell. This is what one cell of the brain looks like. It looks like a little alien from somewhere, doesn't it? But you see the parts of the nerve cell. There's the nucleus, which of course is the center, the mitochondria, which is the powerhouse of all of our cells. That's when you talk about the mitochondria, that's where all the energy is formulated for our bodies. And then you have the little things that stick out called the dendrites, and just on and on. So that's just a picture of the cell. Next slide. So what can harm the brain? Many things can damage our brain. We talk about brain injury, and the most common cause would be from a fall, from an accident, where you might develop concussion, you might develop more severe brain injury. Stroke can occur in the brain, where we get either a hemorrhagic stroke or an ischemic stroke, which causes a lack of oxygen, which is a little bit down on the list there. Then you have toxins, and we talked about having that coconut water and rum. Well, alcohol is a very significant toxin for our brains. Alcohol has no nutritional value at all, and the ethanol in alcohol can actually damage the brain over time. So it's okay to drink in moderation. I don't judge people for drinking, but it is a toxin. So we have to be cognizant of that. And also, we don't really think about it, but there are a lot of neurotoxins out in our environment, from things like pesticides and things they use on agricultural, sources that help our food grow. But some of these things are neurotoxins. And I wish I had known about these things when I was, bringing my kids up, or even pregnant with my kids, because now they're thinking that a lot of these neurotoxins are causing illnesses like autism and other neurological diseases. So if you know someone who's trying to get pregnant or pregnant now, just encourage them to eat organic foods and things that don't have a lot of toxins. Then we talk about infections such as encephalitis or meningitis. Those things can affect the brain. Encephalitis can be caused by viruses. The most common one would be herpes simplex virus. Of course, tumors, aneurysms, neurologic illnesses such as multiple sclerosis, and even COVID. Now they have COVID brain syndrome, and so that's become an entity that we talk about now. And we talk about abuse of illegal drugs, marijuana. lot of us, our young kids are smoking that now, but that's not without harm. So be careful about that. So next slide, please. So we're going to take a commercial break and do a little bit of a brain teaser. So I have a couple of questions to ask you. A man is looking at a photograph of someone. His friend asks who that is, and the man replies, "Brothers and sisters, I have none. But that man's father," I can't see because my thing is in the way. I'm going to have to try to find it.
Get to the stuff she's saying.
Maybe you can read it for me.
But that man's father is my father's son, who was in the photograph.
Yeah, there you go. The pictures are on the way of your beautiful faces, so I couldn't see it. Okay, so a man is looking at a photograph of someone. His friend asks who that is. And he says, "Brothers and sisters, I have none, but that man's father is my father's son." Who was in the photograph?
Him.
Who?
Is it him?
And that's what Lydia Thomas to everyone. He is the photograph. Or did he type that?
Well, the answer is his son.
His son.
Oh, his son.
His son.
Yeah. So just a little brain teaser. Okay, second one, is the capital of Kentucky pronounced Louisville or Louisville?
It's Louisville.
Depending on where you're from, both.
Yeah. It's spelled Louisville.
Anybody have another guess?
My friends called it Louisville.
It's Louisville, yeah, Louisville.
Everybody's wrong. The capital of Kentucky is Frankfurt.
Oh. Frankfurt.
All right, so on with the commercial. So that being said, we need to stimulate our brains, don't we? So there's some, and those are just kind of silly brain teasers. I wouldn't worry about them.
Oh, yeah, I was supposed to get that.
Yeah, so there's some free games out here, free apps. And one is called Luminosity or Lumosity.
Yep.
And it's a free app that you can get on, your phone, your Android, and had lots of brain games. So I would suggest getting something like that. I know some people are into Sudoku, which is more like a mathematical type puzzles. Of course, crossword puzzles. And then there's something called FitBrains Trainer. And this is a free app that has over 360 games that you can play. So these are things that I would suggest, rather than sitting around watching television, try some of these brain games, and they can help stimulate your brain. Next slide. Okay. Now we're on to dementia. So people think that dementia is a natural part of aging, but it's not. Dementia is not an inevitable part of aging. Most of us will never get Alzheimer's or other parts of dementia. So, don't worry about it too much, but the prevalence of the United States is about 6.5 million people at this time. And we have 360 million people in our country. So that shows you what percentage of people have dementia. It's not a great proportion, but it's increasing. They suggest by 2050, there are going to be about 14 million people who suffer from dementia. And that's simply because we're getting older. We're living longer. And the older we get, the more apt we are to have some type of dementia. But again, most people are not going to get dementia. Studies actually show that things get better with age, such as our verbal abilities, our ability to reason, visual spatial skills, improve. Math, basic math skills improve. We're able to tune out negativity because there's an organ in our brain called the amygdala, which becomes less sensitive to negative thoughts as we age. And as we get older, we become more content. We don't sweat the small stuff. So a lot of things are better as we age. And I think, I know there are a lot of young people on this call, but I think those who are older can attest to that our vocabularies are better and that we're able to reason a little bit more. And I think that's where the adage that wisdom increases with age, because it does. So we have a lot to offer and a lot to look forward as we get older. Next slide. But should you worry? So here's some things that are normal part of aging, and things where you might want to talk to your doctor. So normal aging, you sometimes search for words. Talk to your doctor, you use the wrong word, such as you might use stove when you're actually meaning the table. You can't find your car keys. Guilty. Talk to your doctor when you don't remember how to drive or where you're going. Now that's a problem. You forgot what you ate for dinner last night. That happens. But it's a problem when you forget what you ate and somebody tries to remind you what you ate, but you don't remember. You can't recall it. You have trouble deciding which entree to choose at a restaurant, but ultimately you make a choice. Talk to your doctor when you find it impossible to decide what to eat, what to wear, or make other daily decisions, especially on your own. You need help to do those things. Normal aging, you lose your temper a little more easily during an argument. Talk to your doctor. You scream at your partner often. So that means that you're becoming more irritable. You can't take the pressure, you can't take the stress that you were able to do, in your younger years. So that's another reason to talk to your doctor. So a lot of these things are normal part of aging. Can't find your keys. You may not be able to remember a word when you're searching for it. Can't remember what you ate for dinner last night. And those are not issues. That's just normal. But the things on the other side, part of the screen or the slide are some things you need to be cognizant of or worry about. And you might notice some of these things in your family members. So just keep that in mind. Okay, next slide. So what happens to the brain as we age? Well, the brain shrinks. And, I see that a lot, with, I look at CAT scans and MRIs and things like that. And most of us have some brain shrinkage as we get older. That's just normal. We get a decline in those synapses that connect each cell of the brain. The covering of the nerve cells diminishes, and that's called myelin, and that decreases. You get decreases in chemical messengers such as dopamine, norepinephrine, acetylcholine, and serotonin. And serotonin is that hormone that affects our mood. So that's why they think as we get older, a decline in serotonin may lead to depression. So depression can increase as we get older, and that might be due to that lack of serotonin. The frontal lobes and the hippocampus start to shrink. And that frontal lobe controls our planning and organization, our executive thoughts, and short-term memory. So as you can see, as that frontal lobe starts to shrink as we age, some of those functions start to decline. Then we get a decrease in blood flow to the brain, and that can occur because of, plaques from lipids or cholesterol. And you get inflammation. As we get older, those inflammatory cells, like those cytokines and things like that, start to increase. and start to affect our brain. So next slide, please. So dementia, types of dementia. The number one cause of dementia in this country is Alzheimer's. Why it happens, we don't know. You know, most cases we'll never figure out why it happens. There is a genetic component to it, but that's just a small percentage. You know, just because your family member has Alzheimer's doesn't necessarily mean that you're going to develop Alzheimer's. There may be a slight increase chance that you might, but it's not inevitable. Most of the time, we don't know why it happens. The brain, what happens with Alzheimer's is you get these plaques and these tangles. And if I had a picture of it, I could show you how it looks. The brain actually looks like a meaty, shrunken piece of meat because it has all these plaques and tangles. And because of that, the nerve cells can't function correctly. And of course, you're going to have a decline in your memory. Vascular dementia is the second most common, and that's due to things, you know, that we have like hypertension, diabetes, elevated lipids, and that increases our risk for vascular problems like strokes, and the small blood vessels in the brain start to shrink and become damaged, and it decreases our white matter in our brain. There's another dementia that's pretty common and we don't know about it. It's called Lewy body dementia. And that occurs because their abnormal clumps of protein start to affect our brain. But this is different because we start to act out our dreams, our behaviors start to change. We don't sleep as well. Some people develop visual hallucinations. We lose focus and attention. Our movements may slow down, we'll develop tremors and Parkinson-like activity. It looks like somebody has a question. Okay.
Post it again, Katrina. Nydia Thomas, Dr. Lyman, is there a way to build new brain cells or use nutrition?
Well, no, once the brain is damaged, there's no way to rebuild the cells. So of course, the best thing to do is try to protect it. And, you know, we'll talk about that a little bit later. But, you know, unlike the liver, where you can regenerate the liver if it's damaged, once the brain is damaged, there's no going back, unfortunately. Okay, next slide, please. So there are some reversible causes of dementia, and we don't really think about that, but you know, there are some vitamin deficiencies that can cause dementia, metabolic problems can cause dementia, such as thyroid problems, low blood sugar. You know, for instance, people with hypothyroidism can sometimes develop confusion. Their brain slows down because the thyroid gland monitors or manages our metabolism. And if you're not producing enough thyroid hormone, all your systems kind of shut down and slow down. And that can cause the fogginess of the brain, decreased brain functioning. So those are some things to think about. Also, vitamin B1, vitamin B12, which we need to supplement our diet with. Vitamin E deficiencies can also cause dementia. And there's something called normal pressure hydrocephalus that physicians don't often think about as a cause of dementia, which can be reversible. And this condition causes enlargement of the ventricles of the brain. And Oh, somebody's talking. So the key here is if you have a family member who you think is suffering from Alzheimer's or dementia.
So Katrina, can you mute that person who's talking?
I'm working on that now. I'm running to
Okay.
the screen. Hold on. Looks like they figured it out. Go ahead.
Okay, thanks.
So when you bring a relative in who you think might have dementia or Alzheimer's, make sure the doctor checks these things. Check your thyroid hormone, check your blood sugars, check your vitamin B12 levels. And also look for something called normal pressure hydrocephalus, which they can look at by doing a CT scan or MRI of the brain, because those are reversible causes. You can treat them, you can take medication, vitamin supplements. So these are some things to think about. Next slide, please. So some symptoms of memory loss or dementia. Of course, the number one thing is memory loss, which you may notice yourself or your family members usually start to notice that. Difficulty communicating or finding words, difficulty with visual and spatial abilities, difficulty reasoning or problem solving, difficulty handling complex tasks. So if you're at work and you're not able to do your work task, or you're not able to, some people used to have a checking book and they would balance their checking. We don't do that anymore, but some older people might still do that. And you're not able to do that, not able to pay your bills. You can't plan or organize. You're off balance. You're losing coordination. You're more confused and disoriented. And you may notice some of these things in your older family members. And if you do, make sure you take those people to the doctor to get checked, because they could have reversible causes of dementia. So it's important to know the signs. Next slide, please. Other things that may occur, such as personality changes. We don't think about that, but increased anxiety. If you find somebody who's more anxious, inappropriate behavior, such as inappropriate laughing. Some people who develop dementia, they have more overtly sexual in nature. They may become paranoid or agitated. Some people start to hear or see things. And depression may occur. Next slide, please. So how do we protect the brain? And we talked about that a little bit last week. You get mental stimulation. We talked about the free apps, the games that we can play, crossword puzzles, reading, just stimulating your brain, getting a new hobby, listening to music. All those things can help stimulate our brain, improve the connections, the synapses that we have that control our brain. Physical exercise. We talk about getting at least 30 minutes of exercise 5 days a week. Doesn't have to be 7 days, but 5 days a week. Gradual exercise. You can do it 10 minutes, 3 times a day, but just getting some exercise, getting up from your chair if you have a desk job. But you got to keep moving. Getting fresh air, getting vitamin D, getting out in the sun. It's very important, especially for us who live in colder climates where we don't get sun. Go outside, put your hands up so the sun can kind of emanate through your hands and increase your vitamin D levels. Improve your diet. And of course, we talked about that last week with the plant-based diet. Increasing your consumption of fruits and vegetables. Don't necessarily have to give up meat right away, but try to make it at least 80%, 20%. Control your things that are controllable, like your blood pressure. Very important, because as we can see, increasing blood pressure, diabetes, and things like that can affect the small blood vessels in our brain and cause vascular dementia. And we talked about improving blood fats and cholesterol. Also consider a low dose aspirin. Studies have shown that a low dose aspirin can help improve brain function by increasing circulation. But of course, you want to talk to your own doctor about that, because not everybody's able to take an aspirin because of the GI side effects and things like that. So next slide, please. And of course, avoid tobacco. We all know that. Don't smoke. Don't abuse alcohol. Drink in moderation. Care for your emotions. If you find yourself becoming more anxious, you're not sleeping well, you're worrying more, you're not eating well, you don't care about things that you used to care about, these can all be signs of depression. So be aware of that for yourself and for your family members. Protect your head. When we bicycle, when we rollerblade, any of those sports that we partake in, wear a helmet. So protect your brain, because getting a concussion or several concussions in your younger years may lead to brain damage in your older years. Build social networks. They find that people who are lonely, who don't have a social network, they tend to develop dementia more often. So make friends. Nowadays we're not out as much, but connect through Zoom. Phone your friends, phone your family members, talk to them on the phone, make those connections. And then we talked about getting adequate sleep. And for adults, that's between 7 to 9 hours of sleep per night. Not 4, not 5, but 7 hours of sleep. And that is very important. And you can notice the difference if you're getting those 7 and 8 hours of sleep. You feel more refreshed, you're able to function, you're able to think better. So sleep is a very important thing that we don't think about. And for those who have sleep apnea, which means that you're snoring and you're breath holding at night, that can also be a risk factor because you're not getting enough oxygen to the brain. And so if you notice your sleep partner or a family member snoring and gasping for air, have them get checked by their doctor. Next slide, please. All right, so foods linked to brain health. We talked about our green veggies. We all know about that because we're in this program. So our collard greens, our broccoli, all these things help detox our brain, provide antioxidants. People who eat fish, the fatty acids, the omega-3 fatty acids are important because that's what the brain is made of. It's made of omega-3 fatty acids. So it's important to have those in our diet if you eat meat or fish. Berries increase our flavonoids. The darker the berry, the sweeter the juice, and the better the protection for your brain. Tea and coffee. So for us coffee drinkers, it's okay to have some coffee. It helps stimulate the brain, and coffee itself can be an antioxidant. And then nuts. We all know that nuts are good for us. Walnuts are a very good source of protein and other benefits. Next slide, please. Then other nutrients include flax seeds, kiwi, walnuts, and these all provide omega-3 fatty acids. Turmeric is a great antioxidant, and I add that to a lot of my foods, whether they're vegetables or a protein source. Cocoa, green tea for the flavonoids, we talked about that. Coconut oil, palm oil, and something called ghee, and I think that's sort of like a butter, and that provides saturated fats. We talked about our B vitamins, and I would recommend that if you don't take a supplement that you do, because often we're not going to get our B vitamins in everything that we eat, especially if you're going more plant-based and becoming a vegan. you might not get all the B vitamins that you need. So I do recommend a supplement, and I take one, it's a gummy. So I take a little gummy that I chew every day and has all my B vitamins and vitamin D, etc. So mushrooms, I love mushrooms. Great source of nutrients for our brain. Asparagus, avocados, olives, spinach, wheat germ, and those provide vitamin E. Next slide, please. Other nutrients such as citrus fruits, which provide vitamin C, almonds, sunflower seeds for zinc. Zinc is a very important mineral for our brain. Brazil nuts, black pepper, and blackstrap molasses provide copper. That's another mineral that's important for our brain function. And lentils and beans for iron, as well as protein. So as you can see, there are many, many different foods and nutrients that we can eat. And a lot of these things that we're going to talk about as we go through the program. So they're all very important for brain health. Next slide, please. So these are some of the resources that I looked at to get some of the information that I talked about today. I looked at Northwestern Medicine for Northwestern Memorial Healthcare. I always look at Mayo Clinic for a lot of my resources, and WebMD is another site that we can, any of us can Google and look for some of these tips on healthy brain function and healthy brain nutrients and how to protect our brain. So I thank everyone for listening to me. I know these are a lot of brain facts, but I hope you're able to take something away from it today and improve your brain health.